Good day everyone, and thank you for attending our today's session. This is Kassem Chaalan, the Director of the Disaster Risk Reduction Unit of the Lebanese Red Cross. I will be presenting together with my colleague Ibrahim Ahmad, the GIS and Business Intelligence Specialist at the Lebanese Red Cross. There is no doubt that the COVID-19 pandemic has affected the whole world. Yet, considering the economic situation of Lebanon and the Beirut blast in August 2020, the effect of COVID-19 in Lebanon was amplified. That caused the overwhelming of the Lebanon healthcare sectors. Problematic area: hospital operating at full capacity, lack of home health care, shortage in oxygen concentrators, shortage in blood donors. Our main objective was to reduce the load on the healthcare sectors by providing healthcare at home, providing oxygen concentrators, and creating a blood donation supply chain. In time of crisis, decision-making and resources allocation becomes more challenging. That is when we turn to the GIS toolbox to make things clear. By mapping resources, identify gaps with analysis, service area, and data collection. The most effective way to turn this problem into solution is through the collection and digitalization of data using GIS, web maps, web apps, data collection, and dashboards that has played a vital role in creating the COVID-19 home care unit. The community is in the heart of our intervention. We have created the hub to make community engagement rich with data and informed with resources. To go with more information about all the solution, I will be handing to my colleague Ibrahim Ahmad. So it's yours, Ibrahim.
Thank you, Kassem. For the COVID-19 home care solution, we have allocated multiple health centers to provide healthcare support by visiting COVID-19 cases at their houses. For that, we have built a very complex workflow using Survey 123 for reporting and dashboards for monitoring. Each center is able to monitor all of the cases that needs a doctor visit or a nurse visit or a follow-up call. For this intervention, we have identified relevant capacities working on the same intervention on a community level. As we also did map all of the COVID-19 cases along with the health capacities related for this intervention. We have created an online survey for registration of nurses and doctors, where doctors and nurses were registered for the home care visits. They were registered with their details in terms of specialties, locality, and availability. Using the hub for the oxygen machine distribution, beneficiaries were able to register to access resources. The solution was designed to meet the community's need, where the patient fills out the survey himself or calls the hotline call center. The requests are registered, then referred to the LRC Medical Committee for approval. Approved requests are transferred directly to the warehouse for execution. For the blood safety and availability, we did build a supply chain for blood, where we do map the blood units available with the request pending, as we also map the blood donors filtered by service area for each blood transfusion center. As an output of this dashboard, we also get a list of potential donors that can be filtered within the map extent or the service area for each center. As our Secretary General said, the GIS has proved that when humanity and technology join forces, we are able to attain the most noble of humanitarian objectives, creating a world tomorrow which is better than it is today. Thank you for your attention. I hope you did enjoy our session.